Since Israel's war on Gaza began, more than 95% of the enclave's business establishments have totally shut down, and hundreds of thousands of people have lost their jobs, according to a statement from the Gaza government's media office. As a result, more than 90% of Gaza's population has dropped below the poverty line, and the enclave has experienced $33 billion in economic losses, said the statement. Gaza's government holds Israeli and US authorities, as well as the international community, fully responsible for the cruel and inhumane conditions experienced by the workers of the Gaza Strip, the statement added. Mossab Nasser, head of the Fajr Scientific Foundation medical non-profit that sends doctors to Gaza, says a team of recently arrived surgeons and physicians are working in tough conditions in Khan Yunis's European Gaza hospital to treat dozens of patients per day. We operated before in Al-Shifa Hospital, at Nasser Hospital, and at the European Hospital. Unfortunately, Al-Shifa and Nasser are almost non-existent at this point, so our focus has been at the European hospital, Nasser told Al Jazeera. Based on our experience so far, the facility lacks everything you can think of, he said. We bring everything we can carry with us to keep the team functional. Nasser added that limited operating space was also complicating efforts by different aid groups to provide medical care, and that efforts are underway to better coordinate their health response. We're trying to bring the different organizations together to work under one plan to be more effective on the ground, especially given the limited resources, he said. Foreign doctors returning from Gaza describe being left speechless by the overwhelming scenes of trauma in the enclave's hospitals. Sharik Saeed, a vascular surgeon from Atlanta, Georgia, says his team treated 40 to 60 patients a day, most of them young people with shrapnel injuries he had never seen before. Most were patients 13, 14, 15, 16 and 17 years of age, Saeed said. And unfortunately, there is a very high incidence of infection, so once you have an amputation that doesn't heal, you end up getting a higher amputation. Ismail Mehr, an anesthesiologist from New York who led the medical mission, said the foreign doctors were speechless when they saw the number of injuries and warned that a looming Rafa offensive would push Gaza's health sector beyond its capacity. I hope and I pray that Rafa is not attacked, Mehr said. The health system will not be able to take care of that. It will be a complete catastrophe. France's foreign minister says there is still work to be done to secure a truce between Israel and Gaza after he met with Egyptian officials in Cairo on the status of negotiations. We came to coordinate our efforts for a truce. The messages given by France and its Arab partners in the region is that Israel pulls back on this offensive in Rafah. Stéphane Séjourné said after meeting his Egyptian counterpart, Sameh Shoukry. He declined to say whether he was optimistic of a deal being concluded, but added that if there were a truce, he hoped that 3 French-Israeli dual nationals being held by Hamas would be on the list for release. State Department spokesman Matthew Miller says the U.S. Secretary of State repeated his country's opposition to an Israeli assault on the crowded Gaza city of Rafah in talks with the Israeli Prime Minister, who was pledged to go ahead. Blinken reiterated the United States' clear position on Rafah 2 days after Blinken again voiced opposition to an assault over concerns for the safety of civilians sheltering in the southern Gaza city. In his meeting with Netanyahu, Blinken also noted improved Gaza aid deliveries and reiterated the importance of accelerating and sustaining that improvement, the State Department said.